This is Democracy Now!, democracynow.org, The War and Peace Report. I'm Amy Goodman with Nermeen Sheikh.
Here in New York and in most other states, a transgender person with Medicaid cannot obtain coverage for hormone therapy, which non-transgender women routinely obtain in the form of birth control. That's a discrepancy activists are trying to change with a new lawsuit. Filed late last week by the Sylvia Rivera Law Project and other groups, the lawsuit challenges a 1998 regulation which prevents transgender people from accessing sex reassignment surgery, hormones, and other forms of care. In this video produced by the Sylvia Rivera Law Project and GLAAD, healthcare providers and transgender people talk about the importance of basic health coverage.
But I've always known that I wanted to move here for the city's vibrant artistic community. As a trans person, I would hope that I'd be welcomed, but many trans people aren't, because we don't have the basic healthcare coverage that we need to survive.
In New York and many other states, transgender people like myself are so often refused coverage, even for routine and preventive care.
Every day people come into the Sylvia Rivera Law Project because they have been denied the basic health care they need to survive.
Transgender people, like all people, are healthier when they get the medical care they need.
Trans medicine is a medically necessary intervention. Many people believe that providing hormones for trans patients is cosmetic, but as a medical provider, I can tell you how crucial it is for the health and lives of trans people to have knowledgeable, trans-friendly providers.
The lawsuit over Medicaid coverage in New York follows a number of recent victories for transgender health care. Late last month, the Federal Department of Health and Human Services overturned Medicare's blanket ban on sex reassignment surgery. The change means recipients of Medicare will no longer have their claims for coverage of surgery automatically denied. Just last week, Massachusetts became the third state in the country to cover transgender health care under Medicaid.
All of this comes as activists are preparing to mark the 45th anniversary of the Stonewall Uprising in New York City, a seminal event that helped launch the modern LGBT justice movement. To talk about all these developments, we're joined by Pooja Gehi, staff attorney and director of the Immigrant Justice Project at Sylvia Rivera Law Project, which has just filed the class action lawsuit over New York Medicaid's exclusion of transgender health coverage. And we're joined by Angie Milan-Cruz, one of the two lead plaintiffs in the suit. We welcome you both to Democracy Now! Angie, your name is the lead name. The other person didn't want to be identified. Talk about why this is so important to you.
My personal experience has been hardship, depression, not being just accepted for who I am. I have to look at myself every day in the mirror and see the perfect me, but I want the whole package where I can feel comfortable under my own skin.
And what would that whole package be? Why sue the New York State Department of Health?
To have the right to have reassignment surgery.
So, Pooja Gehi, could you explain why it is that Medicaid did not do what Medicare did in allowing these procedures?
Yeah, well, the Medicaid regulation in the state of New York is really dated. It goes back to 1998, and it was passed sort of under the radar, and it's a blanket exclusion to all transition-related health care. The only comments submitted were by two physicians who actually said that the care is medically necessary and not experimental. And the state of New York went ahead anyways, and we think now is the time, right, with this Medicare decision. There's also the Affordable Care Act has a regulation that says it cannot discriminate on the basis of gender identity and expression, which we think means all state-based Medicaid programs should also cover transition-related health care.
And they make the argument that somehow Medicaid makes the argument that these procedures are somehow dangerous for people who undergo them, and is that the justification that they provide? Mm-hmm. And if that's the case, then how come that wasn't true when Medicare changed its policies?
Mm-hmm. I mean, I think that is the justification that the Department of Health in New York uses, and it's extremely dated. We've seen, and actually the regulation is supposed to be up for review each year, and we haven't seen any movement on it since 1998. During that time, the American Medical Association has said that the care is medically necessary. The American Psychiatric Association, the World Professional Standards for Transgender Health Care, now Medicare, and the Affordable Care Act. So we think now is the time that New York really needs to get on board.